Most practice owners think they know their numbers, but they're actually guessing. And that's exactly why so many practices feel busy, but aren't actually as profitable as they should be. You've got patients coming in, staff working, your schedule's full, but when you actually look at the data, something's off. So in this video, I'm going to show you exactly how to audit your practice just by using a few key numbers, so you can quickly see where you're losing revenue and where you need to focus. Step 1, start with revenue. Where are you? Ask yourself 3 simple questions. What's your total monthly revenue? What's your revenue per provider? And what's your revenue per patient visit? This is your baseline. And here's the reality. Most practice owners only know roughly estimates. If you can't answer these 3 simple questions quickly and confidently, that's your first problem. It's a visibility issue, and it's something I see a lot of medical practices have. Because revenue tells you how your practice is performing, but it doesn't tell you where the problems are yet. Now, let's look at how much of that you're actually keeping. Step 2, check your collection rate, what you actually keep. This is going to be the percentage of what you actually bill. This is the amount you currently are collecting. So ask yourself this: how much are you billing versus how much are you collecting? And what's your actual collection percentage? Here's an example. If you bill out $100, but you collect $70, your collection rate is 70%. And that's where a lot of practices run into problems. Now, if you take insurance, this is the part that's important. Most medical practices write off between 40 to 60% of what's billed. And this is usually due to contractual insurance adjustments. So right away, you're not keeping everything that you're billing, and that's expected. But beyond those write-offs, this is where the problems start to show up, because you have insurance delays, denials, and inefficient billing processes. So on paper, revenue looks strong, but in reality, you're not keeping what you should be. And here's a key insight. Most practices don't have a revenue problem. They have a collection problem. And even if you fix that, there's still another major leak. Step 3, measure your no-show rate. What are you losing? Ask yourself, what percentage of your appointments are no-shows? If you know how many people no-show per month and you know how much each patient visit is, you can figure out how much you're losing per month due to no-shows. Because this is one of the biggest revenue killers in practices. Every empty slot is lost production. That's time you can't get back. And even if you have 5 to 10% no-show rate, it can add up to a significant amount each month or year. The good news is this is fixable. Simple things like confirmation systems, charging no-show fees, and tightening up your scheduling can make a big difference. But here's some key insight. You may not need more patients. You may just need to stop losing the ones you actually have. So step 4, putting it all together. Your simple audit framework. You only need 3 numbers to start. Revenue that shows where you are, collection rate showing what you're actually keeping, and no-show rate shows what you're actually losing. That's it. These 3 metrics can give you a quick snapshot of your practice's health. And more importantly, they tell you where to focus first. Because once you see the gaps, you can stop guessing and start making better decisions. And here's the reality. Just fixing one of these, your profitability can change fast. Step 5, other metrics to keep on your radar. This is taking things to the next level. So once you have those first 3 dialed in, this is where you level up. These are a few other metrics that can really help you organize your growth. Total patients seen per month. This is your volume engine. If this drops, everything drops. The number of new patients you see per month. This tells you if you're growing or just maintaining. Knowing where your referrals are coming from and who. How many visits per provider per day. This shows you productivity and scheduling efficiencies. And revenue per provider. This is who's producing and who's not. Because these are the numbers that actually drive your business day to day. But don't overcomplicate this. You don't need to track everything. You just need to track the numbers that matter. So if you want to grow your practice, don't try adding more patients. Start by understanding your numbers. Because once you fix leaks in your system, every new patient becomes way more valuable and your business becomes more predictable. But here's the problem. Most practice owners don't have a simple way to see all of this in one place. And that's exactly why we built the KPI Intelligence Dashboard. It's specifically for healthcare providers, and it gives you a clear snapshot into your practice. It tells you what's working, what's at risk, and where to focus next. So instead of guessing, you can start making data-driven decisions. If you want to see exactly how this works, click the link below to check out the KPI Intelligence Dashboard. Otherwise, I'll see you in the next video.